Foraminal stenosis. Are you struggling with leg pain, sciatica, or numbness in your foot and feeling overwhelmed after seeing this term, foraminal stenosis, on your MRI report? You're not alone. Most people are never told how foraminal stenosis is causing their pain, and it can leave you feeling anxious and unsure about what comes next. But here's the good news. You may not need back surgery or heavy medications to find relief. In this video, I'm going to show you 5 easy, safe exercises that can help you relieve the pinched nerve, the sciatica, the leg pain caused by foraminal stenosis. These exercises have helped thousands of my patients get real, fast relief, and now you can benefit from them too, right from home. I'll demonstrate each exercise in a specific order from 1 to 5, so please make sure you don't skip ahead. Each move builds on the last one for maximum effect. Exercise number 3 is my personal favorite for relieving pain and restoring mobility. And here's something special. After you reach the 5th exercise, keep watching. I've included a bonus 6th exercise that will improve your lower back mobility, which is crucial for reducing nerve irritation for foraminal stenosis and keeping you pain-free for the long run. It's going to give you stability and strength and really help with everything overall from a back perspective. These are simple, effective movements that anyone can do, no equipment, safe, just a few minutes a day for lasting relief. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for over 30 years now. My YouTube channel focuses on helping those who've been suffering from serious, debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. I upload a new video every week. In addition to that, I've created a free Health Vault. It's a collection of exclusive videos that get delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it at the link in the pinned comment below. In a moment, I'll guide you through the 5 exercises and the bonus exercise, if you stay to the end, that will help relieve leg pain caused by foraminal stenosis. But first, let's review what foraminal stenosis is. So if we go back to our model that you've seen before, this is what your entire spine is made up of. You'll have a vertebrae, there'll be a disc in the middle. That disc is there to actually create space. There'll be another vertebrae, another disc, another vertebrae. The space you're wanting to create is where the nerve exits. So you can see this yellow guy here. That's the nerve, and that nerve is coming right off the spinal cord, which is inside the spine. We want to have that space there. People think it's shock absorption. They think it's, structure, stability. The biggest thing it's doing is it's creating space in there. You want that space so that the nerve is not interfered with at all, so there's no compression on the nerve and so forth. That's what we're looking for. So what foraminal stenosis is again, remember, foramen, it just means opening or passage or hole, and especially when we're talking about bone. So it is a passage or an opening for that nerve to actually come out. And then wherever that nerve goes to is the function that we want from our nervous system. So if that nerve is exiting the lower back, that nerve is going down to a specific part of the leg. That nerve might be going to the bowel, the bladder, the reproductive organs, depending where that nerve is exiting. So when you see that on an MRI report, when you see foraminal stenosis, stenosis just means narrowing. And so same thing when we talk about heart disease, you're actually narrowing those blood vessels. So what we're doing here is we're in foraminal stenosis, you are narrowing the opening where that nerve comes out. And obviously we don't want that. You don't want compression on those nerves. Sometimes we refer to as neuroforaminal stenosis. Sometimes it's foraminal stenosis. Sometimes it's neuroforaminal narrowing. They all mean the same thing. You're actually narrowing that opening, which puts more compression on the nerve. Now, what causes that foraminal stenosis? Well, there are a number of things, but really 3 main things. So remember, again, in our model here, we have a nice thick disc. The thicker the disc, the more room for that nerve to come out. What happens, the number 1 cause of foraminal stenosis is degeneration. And we've talked about this in previous videos. So whether we're talking about spinal degeneration or spinal decay or degenerative disc disease or osteoarthritis, they all mean the same thing. So first it starts by narrowing of that disc. And then if it progresses from there, it doesn't just narrow, but you then, when it gets more advanced, you then start to get what we call spurs or osteophytes. So this is bone. These are the sharp edges of bone. But what both of these things are doing, is they then start to narrow that opening and put more compression on that disc. So that's number one, is typically degenerative disc disease is going to narrow that opening, that foraminal stenosis. Number two is, again, if we look at this model here, disc herniation will do that. So here, if you can see, now the disc is actually bulging out or herniating, and that will also put pressure on that nerve. That's, again, going to narrow that opening. The number three most common thing is what we call spondylolisthesis. This usually comes from some type of injury, enough force to literally cause the vertebrae to shift one on another. And if those vertebrae shift, again, that's going to narrow the opening. That's going to put more compression on the nerve. So those are the three main things that will cause foraminal stenosis. Now, when you have that foraminal stenosis, what a surprise, since it's putting pressure on the nerve and that nerve goes down the leg, that's what's going to cause your leg pain. That could be numbness or tingling or pins and needles. Now, let's not get this confused with spinal stenosis. And again, there are different terms for this. Some people call this lumbar canal stenosis. The difference there is the stenosis is not, the narrowing is not happening where that nerve exits. Where the narrowing is actually happening is right to the spinal cord itself. So it's happening right in the spinal canal when we talk about spinal stenosis. So that's the difference. We've talked about this in a previous video. The difference between spinal stenosis, or some people just refer to it as lumbar stenosis. That's really not descriptive enough. But the difference is it affecting the canal? When it affects the canal, then it's where all of those nerves may go to that branch off that canal, versus is it just affecting the nerve root that's exiting at that one particular level, which is the foraminal stenosis. Again, I've discussed this in detail in another one of my videos. Now, how exercises help with all of this is what we're looking for, is we're looking at exercises that are going to deal with each of those causes. So that's one of the neat things you're going to find in the video, is we're going to give you specific exercises depending on where your foraminal stenosis cause is actually coming from. But the goal is to try to increase the opening. The goal is also to try to restore movement, which pumps more nutrients into the disc, to increase mobility as well, also to get some flexibility in the musculature. That the flexibility in the musculature is more of a temporary relief. We really want to get to the underlying cause of what's happening. If we can do that, that's when you start getting relief to the numbness, the tingling, the pins and needles you're feeling in the leg. Now, let's get into the 5 best exercises for foraminal stenosis and relieving that pain. Now, one of the key things when it comes to exercise in general, let alone for foraminal stenosis, is we need to be specific to what we're trying to accomplish. I know that sounds so obvious, but you will see thousands of videos on YouTube all giving you the average exercise for the average person. And that's not what we're looking for. We need to, if you can understand what's causing the problem and then design an exercise that's to help alleviate that problem, that's when you're going to see maximum results. So when we're talking about exercise, it's a combination of things that we're looking for, especially with foraminal stenosis. We want to introduce movement. The more, that old adage, if you don't use it, you lose it, is very true. So the more movement we can get, that movement, though, however, has to be specific to foraminal stenosis. So movement in general is going to be positive, because what that does is that will actually pump more nutrients into the disc. That will help with the degenerative disc disease. But then what's key is, one of the things we want to do is we want to differentiate, is that foraminal stenosis, what's causing that? So we've already gone over that in the video. If it's coming more from degenerative disc disease, then we want to do things that are going to increase movement, pump more nutrients into the disc. If there's a lot of pressure on that nerve as it comes out of that foramen, then ideally we want to do a movement that takes pressure off that area. We would not want to do a movement that puts pressure on that area. If it's coming from a disc herniation or a disc bulge, then there are very specific movements that will help to take pressure off the disc that is then enclosing or putting pressure on that nerve as it exits the foramen, and you're getting that foraminal stenosis as well. So all of this is of key importance. We'll explain each of these as we go through them. We are doing this in a very specific order for exactly that reason. We don't want to give you the top 3 core exercises that work for everyone's low back. That's simply not true. That's not in your best interest at all. Please pay attention to each of the movements. This is not something you should go through mindlessly. It's something that if you understand, then again, you'll get better results. Follow the order, and I'll explain why we're going through this very specific order. and remember to breathe. And we're not supposed to be holding your breath as we go through these stretches. So the very first stretch we're going to do is what's called a cat-camel stretch. And what we're doing is we're essentially mimicking what a cat's going to look like and what a camel would look like. And we're really getting a pelvic tilt moving in there. And it's going to be a movement of extension and flexion as we go through these movements. So in a cat-camel, very simply, you're going to be on your knees, on your hands, okay? And we're going to arch the back upwards as a cat would do if you're getting a cat stretch like that. Okay? And then we're going to arch it inwards. You're going to let that belly drop. And then you're going to really only need to hold for a few seconds. And then you're going to repeat. You're going to arch upwards. You're going to arch inwards. And so by going through this movement, what we're doing is we are actually introducing movement into the spine. The more movement, the more nutrients will come into the disc, the less that will degenerate. That's all very positive. We want to do this a good 5 to 10 times each way. You can hold it for as long as you feel comfortable, but it only needs to be 5 seconds or so. And pay attention if when you're doing the movement where you're arching it one way and that's actually causing pain, then that's telling you that that's not necessarily a good exercise for you. That's indicative, is the foraminal stenosis coming more from the disc herniation, or is it coming more from the degeneration? These are, again, two completely different things. When it comes from a disc herniation, think of a jelly donut. So if I push on one side of the jelly donut, I will actually squish the jelly out the other side. So that's why if your foraminal stenosis is coming more from a disc herniation or a disc bulge, we want to avoid flexion type movements, because the flexion type movement is actually going to push that disc out further. Whereas if it's more of a, for instance, a central canal stenosis, coming forward will actually take pressure off that. It's the same thing that we want to do. You may have foraminal stenosis worse on one side than the other. So if you have a lot of foraminal stenosis, say, on one side, this movement is going to take pressure off, but it also could be putting more pressure on the opposite side. So with any exercise that you're doing here today, I want you to actually feel what's happening, and that will be indicative of actually helping you determine what the actual underlying cause is. So number one, we're going to do the cat-camel. Number two, okay, we're going to do a pelvic tilt. So a seated pelvic tilt is, again, very straightforward. So in a seated pelvic tilt, again, we've seen these before in a number of my videos. Everyone understands what a pelvic tilt is. You're either tilting the pelvis one way or the other way. I prefer seated because, in this particular case, because a lot of people who suffer with this sit for a living. And so if we can actually teach you how to do this movement while you're sitting, that's going to be beneficial to you. So you're going to come more forward on the chair. And when you're more forward on the chair, what you're going to do is, again, it's just a matter of basically tilting the pelvis backwards, hold it for a few seconds, tilting the pelvis forward. And as you do that, one movement is going to move the spine one way and the pelvis one way, and the other movement is going to do it the other way. And again, the reason I'm having you do this in this order is it's going to allow you to feel what's actually happening. It's going to give you some information as to what's causing the foraminal stenosis in the first place. So if it's something where doing the pelvic tilt one way actually creates a significant amount of pain or actually aggravates the nerves that are coming down the leg, then that's obviously a movement we're going to want to avoid doing. If you find the other way is actually alleviating that, then that's the type of stretch we want to continue to do. So it's something where, again, you're going to do the pelvic tilt one way, you're going to hold that for a few seconds, you're going to go back and do that the other way. So understand, for the first one, for the cat-camel, try to do that at least a couple times a day. Ideally sets of 10. That's more. You're going to need to be on the floor in most cases. For the seated pelvic tilt, you can do that multiple times a day. It literally only takes a minute to do that. And the more we can get movement in there, as opposed to the static sitting that people are doing all the time, the better off that's going to be for the spine and to help the foraminal stenosis and to help both the back pain and the leg pain as well. Exercise number 3 is one of my favorites. It's what's called the chair hang. So by now, between the cat-camel and the seated pelvic tilt, you should have some information on which movement is actually beneficial and if there's a movement that is actually causing a problem in there. So when we get to the chair hang is best for people where there's a lot of pressure on that foraminal stenosis as the nerve is exiting there, because this is a movement that's going to take pressure off that. This would not be a good movement for someone where it's the disc herniation that's creating the foraminal stenosis, because again, it's going to be that jelly donut. If I push one way, I'm going to squeeze it out the other way. So on a chair hang, you're literally going to hang from the chair. You're going to come forward, you're going to grab the outside of your ankles, and you're just going to hang downward. And you're going to do that to get a good stretch all through the lower back. But it's not just a question of getting the stretch. Again, you're actually opening those foramen, where what we call the facet joints meet, and you're taking pressure off the nerve. Again, that's what we want to do. You hold that for a good 10, 20 seconds. Okay. Now, again, you're going to avoid that if your problem is coming from a disc herniation. But if your problem is coming more just from foraminal stenosis from degeneration, this should actually be beneficial to you. Okay? And again, that's something that you can do multiple times a day. Ideally 2 or 3 times a day. I know what you're going to say. A lot of people will say, well, if I do that hanging off my chair, people are going to look at me strange. Here's the thing. I've been saying this for 30 years, is no one's going to look at you strange because so many other people are suffering from the same thing. So if anything, you're going to start a movement where more people are going to start to do this as well. Now, exercise number 4 is going to be the back extension. This is going to be the opposite of the chair hang. And this is going to be more so if your foraminal stenosis is coming more from a disc issue, a disc herniation or a disc bulge. So again, we're giving you the best exercises we can. We're trying to teach you why you would do certain ones in certain situations. We're trying to give you some insight as to what might be causing that foraminal stenosis. If you're finding a lot of difficulty, please go see a good health professional, either a neurofunctional chiropractor who specializes in this, something along those lines, someone who understands it's not putting you on the average exercise for the average person. Now, if it's a disc issue, well, remember, we don't want to go in flexion. We want to do the exact opposite. So we want to get into back extensions. So a back extension is I'm lying on my stomach, and I can start very simply, just gently either on the forearms, and I'm actually extending at the lower back. And by extending at the lower back, I'm doing the opposite of pushing that disc outwards. I'm also getting some contraction in the lower back muscles, trying to give me some strength in there as well. Again, this is more ideal if it is in fact a disc herniation that's causing a foraminal stenosis. If you want to get more advanced, you can actually then start to come up onto the arms as well. Okay? But again, start as simple as on the forearms. Again, you're going to hold this for only 5 or 10 seconds. You can relax, and then you're going to come up and do that again. This ideally is an exercise that you can do at least twice a day. In this case, you're going to obviously need a floor to be able to do that as well. Exercise number 5. At this point in time, you should have a good understanding, and this is why we're doing the exercises in order to help you determine this. Exercise number 5 is going to be what I call the QL hang. So the muscles that come down the sides of the lower back are called your quadratus lumborum, big fancy word. And what I call a QL hang is you're just actually going to be going from side to side. You can do the standing, you can do the sitting. We're actually going to do this sitting since we're in this position. And so all you're going to do is come over to the one side. Okay? And you're going to think, okay, well, that's stretching this area. And it is stretching that area. But what it's also doing is it's taking pressure off that foramen, pressure off the nerve where it's exiting that foramen. Again, you're going to have some insight where if there's a lot of stenosis, for instance, on one side, then if I open up the side where there's that pressure, it should feel better. If I'm going to the side where I'm actually compressing that, and that's where there's more actually stenosis in the foramen, you may not necessarily like this movement as much. So again, side to side, you can do this again a couple times a day, morning, afternoon, evening. Okay, go to the point where you feel a good stretch. Again, none of these things should cause pain in there. And again, ideally, you want to do at least 5 to 10 repetitions of each of those as well. So the whole goal is why we took you through this in a specific order is to help you identify what's actually a major factor in causing the foraminal stenosis as well. So that's why the CAMEL, the seated pelvic tilt, they're going to tell you whether flexion or extension is better for you. If you're good in both of those, then go through both of those movements. Okay? The chair hang is more specific. If we actually know that it's, that there's a lot of pressure from degeneration that's causing that stenosis, so we're opening up that area. Whereas the back extensions are going to be better if we know that it's a disc causing that. So by doing that, we're not bulging the disc out backwards even more. And then the QL hang is trying to take the pressure off on either side as we do that stretch to actually, again, open up the foramen and also to actually get some stretch in the musculature as well. So understanding all that makes a huge difference in terms of getting the benefits from these exercises that you want. Now, last but certainly not least is one of my favorite exercises. One of my favorite exercises because it's so important for people who suffer with low back pain coming from anything, let alone foraminal stenosis. There are very few exercises that you can do that can benefit pretty much every condition that you have for exactly the reasons we were just talking about. An exercise for a disc herniation is often the exact opposite movement of one for a central stenosis. But the exercise number 6, your bonus exercise, is one everyone can do. It is actually one of what I call my invisible exercises. You can do this multiple times a day. And so almost everyone, because the fact that we sit for so long periods of time and so forth, have actually lost their ability to contract their glutes properly and to then get the support that they need. So bonus exercise is what we call glute activation. So glute activation, while I've been talking to you, I've been doing this exercise, and you may not, in fact, even know I'm doing this exercise. You can do this sitting, you can do this lying down, you can do this standing. And glute activation just means that you're going to squeeze your bum muscles. You're going to squeeze the gluteus medius, and you're going to hold them for 3, 4, 5 seconds, and you're going to release. And then you're going to hold them for 3 or 4 or 5 seconds, and you're going to release. Because so many people sit for a living, we've actually inhibited those muscles. So by actually getting those muscles to work again, they're going to support the entire core. And that's the nice thing is it's next to impossible by getting better glute activation. That's not something that will aggravate a stenosis or a herniation or a sciatica. These are all things that should benefit that. So glute activation, please try to do this as many times as you can throughout the day. You can work on all sorts of other things and be doing the glute activation over and over again. And that's what we want for it's really the gluteus medius that we're trying to activate the most. What it does is that's what gives you that support. It's when you're walking, as you take the step, it's not just the movement of moving that leg. You then also need the movement on the opposite, the contraction of the muscle on the opposite side to support you. And so what we're looking for is muscular endurance, not muscular strength. It's not being able to squat as heavy a weight as you can. It's about being able to use those glutes all day long. So it's contract and then relax, and contract and relax. And I can do this sitting in a car. I can do this walking. I can do this lying down. We want to get that glute activation in there. So please try to do all of those specific to you. So cat, camel, seated pelvic tilts are going to help determine what's the main cause of what's causing the foraminal stenosis. The chair hang, again, going to be more specific if we're trying to open that area. The back extension, more if it's the disc problem. The QL hang, pay attention if left or right is better for you. And then certainly activate the glutes. And again, if the condition is serious, there's unfortunately a number of people where they can have more than one condition. Almost everybody does. So unfortunately, as much as we've tried to differentiate this for you, some people have a disc herniation and still have degenerative disc disease at the same time and are actually having more than one factor creating that foraminal stenosis. Again, that's when you need to see the true expert. You now have a 6-exercise routine to help relieve leg pain, numbness, and tingling caused by spinal degeneration and foraminal stenosis. Give them a try and then come back to let me know which exercise gave you the most relief. Was it exercise number 1, the cat camel? Was it exercise number 3, the chair hang? Please comment below and share your experience. If these exercises helped you, don't forget to like and share so more people can benefit from this relief. Remember to subscribe for more insights and strategies on relieving back and neck pain naturally without the need for drugs or surgery. And don't miss the next video where I dive deep into the key differences between foraminal stenosis and more lumbar central canal stenosis. It's a must watch if you want to fully understand your condition and how to manage it.